identified as non-self, our immune system is going to attack it. So why that this is a misfire? Nothing but the streptococcal sore throat is taken place, and against the streptococcus antibodies are produced. These antibodies directly targeting the mitral wall in the heart, causing the rheumatic heart disease and also synovial membrane. So that is what the first thing, failure to recognize some cells as self. Second is cells seen as foreign are attacked and destroyed. So if they consider that it is non-self, then immediately the very important system of the immunity is to target it and immediately remove that. This is what it is happening even in the conditions of autoimmune diseases. So autoimmunity, if you see autoimmunity or autoimmune disease, there are two things: adaptive immune response specific for self antigens. Because you know, most of your academicians very much know that humoral and cell mediated immunity is there. Humoral immunity is mediated through B cells, beta, that is B cells, B lymphocytes. B lymphocytes are going to produce the antibodies from the body, which is getting the signal from the T lymphocytes. So T cells reactivity or response and B cell response is something different here. So autoimmune diseases, around 60 to 80 inflammatory diseases are identified so far, and the list is gradually growing up day by day, and prevalence is 5 to 8% in US, and prevalence is greater for females than males. We do not know, 75% cases are related to the females and less number is for males. Identified that this is because of mediated hormones. Hormones mediation is much. Autoimmune diseases result from complex dysregulation of innate and adaptive immunity with subsequent tissue. So here you can see the macrophages are frontline defenders of immune system. They receive any microbe which is coming from outside, and then immediately they identify and they communicate to the T lymphocyte, and T lymphocyte again communicate through dendritic cell to the B lymphocyte. B lymphocyte is going to produce the antibodies. Antibodies are targeting the antigens produced by the microbes. This is what the war is taking place, cell war and humoral war. So humoral war is maintained by targeting. It is just like a missile. Anti-missiles are, missile is fired by the opposite, and anti-missile is fired by us. So this is what the antigen-antibody reaction is taking place. But cell-mediated immunity, cell-to-cell activity is also taking place. So, but if here what is happening, these auto-antibodies which are produced against the microbes, they are targeting the own body tissue, not because of some certain similarities in the antigens produced by the microbe, and also the antigens which are autoantigens of our own body tissue. So that is what the triggering phenomena is taking place. So later it is going to cause devastating effects, and you can see the autoimmune diseases they are, and what is the manifested here, and this is also known. And genetic predisposition, initiation, perpetuation and progression, clinical disease and autoimmune disease is manifested. So autoimmune diseases, they are mediated through HLA type, human leukocytic antigen type. So that is genetic predisposition. Sex hormones are also playing vital role. That is the reason why females are more affected. And environmental factors are also, certain chemicals are also going to trigger the autoimmune phenomena, certain drugs, certain infections. But you remember that all the people who are exposed to streptococcal sore throat is not getting the rheumatic fever. So that means our rheumatic heart disease is also not developed by them. Only certain set of people. Why that certain set of people are getting the autoimmune phenomena triggered? So I remember a case, a lady gave a birth to 1 year a child, and after 1 year of the child, husband died. So that lady brought up this son, and the son became 30 years old, and he got the job, and he is well settled, and he is going to be married. She is planning to get him married. At that stage, his son exposed to major road traffic accident and died. So within 6 months, I saw her having the complete weight loss, that is type 2 diabetes and polyarthritis, that is all the joints are involved, and completely there is a immobility in her condition. That is, psychosomatic factors are also playing vital role because the purposelessness of her life made her to trigger the autoimmune phenomena in the body. So this is one important thing here is model 1, what the modern systems say, a certain human leukocyte antigen LLLs are better at presenting pathogen peptides which resemble self peptides to T cells. So they appear like self. That is the reason why autoimmune phenomena. So another is results in failure of negative selection. That is, presenting self peptides to developing T cells, LLs are less efficient as presenting. So they are less efficient, or sometimes they are presenting better but resemble self peptides. So these two are the causes for the triggering of autoimmune phenomena in the body. So we have different types of diseases here. I focus only these diseases because 80 types of diseases are there so far identified, and Hashimoto's thyroiditis is going to induce the hypothyroidism, and autoimmune hemolytic anemia is also commonly we come across, multiple sclerosis, autoimmune arthritis, good posture syndrome going to develop the nephritis, myasthenia gravis. Graves' disease is also targeting the thyroid and getting the hyperthyroidism, pernicious anemia, insulin-dependent type 1 diabetes is developed. Autoimmune thrombocytopenia, ITP is another common factor where thrombocytopenia is commonly seen. So they are the things, but if you see, n number of diseases are there now affected all over the body. Almost all areas are targeted. If you see, there are certain systemic targeting or focal targetings are also there. For example, Hashimoto's thyroiditis, it focally target the thyroid. Similarly, Graves' disease also focally. Similarly, type 1 diabetes focally target the beta cells. So like that, but systemic disease, systemic scleroderma is there, systemic lupus erythematosus is there, and good posture syndrome where it's focally affecting the kidney. So like that, we have various things where autoimmune diseases, autoantigen and consequences, what they are happening. And similarly, you can see, go through that. This will be shared here and you can go through that. Then coming to Ayurveda, what we can understand, autoimmune phenomena. So this is very important thing. Nahi sarvanyapathyani tulya doshani. All apatyas are not having similar effects in the body. Same dosha, same gunas, they are same guna and same doshas they are going to aggravate. Suppose one individual exposed to one food, that food may not be causing any harm to him, whereas the same is going to cause harm to others. Similarly, nacha sarve dosha tulya balaha. All the doshas are not having similar strength. Nacha sarvani sarirani vyadhi chamatve samardhani bhavanti. That all the bodies are fit to resist the disease condition. That is what vyadhi chamatva charaka sutra sthanam. But while commenting upon that, Chakrapani says, Nacha sarvani sarirani vyadhi chamatve samardhani bhavanti. But this font is disturbed, I think. What he says, vyadhi bala virodhitvam vyadhi utpadaka pratibandhakatvam iti yavat. That is what the commentary of Chakrapani. Vyadhi chamatvam iti vyadhi bala virodhitvam vyadhi utpadaka pratibandhakatvam iti yavat. So these are all vyadhi bala virodhitvam vyadhi utpadaka pratibandhakatvam. Factors act against the disease force, that is one. Already disease must be manifested and then the factors are acting against the disease force, that is vyadhi bala virodhitvam. Already the disease has existed. So there are factors which are fighting against that. And vyadhi utpadaka pratibandhakatvam, that means they resist the development of disease. Two factors are there. One, to resist the disease initially, and second, after getting the disease, it is fighting against the sequences of the, that is to avoid the complications of the disease condition. So baladhishtanam arogyam prakrutastu balam sleshma balam doshaharam balam vyayama shaktya vyadhi chamatva shaktya parishyata trividam balam iti sahajam kalajam yuktikritam. So these are all the the classical references which we get related to the bala and vyadhi chamatva. Vyadhi chamatva, bala are two different reflections. Bala is the physical force, ojas is the dhatusara. Ojas is reflected through bala in the body. So vyadhi chamatva is also one of the aspects of that. So sahaja, you have the innate sarvasara, samaprakriti, sleshma prakriti, they have good resistance. And kalaja, that is influenced by the seasons and age, that is seasonal, we get the hemanta ritu is having good strength in us, and seasonal and age related things are there, but achieved through certain efforts, purushakara. By purusha prayatna, we are going to achieve certain thing, that is called yuktikrita, that is by modifying the diet suitable to your body, that is your prakriti or your geographical condition, you are going to achieve that yuktikrita bala. And medicine, by regular using of the rasayana, you are going to get purification therapies, seasonal purification as per the classics it is said. So then you are going to get the yuktikrita. So ojas is also one of the important, because you know this is quintessence of all the saptadhatus, and this is a very important area to reflect the vyadhi chamatva and homeostasis in the body. Approach to immunity and factors lowering it is, if you see here, tatra rasadinam sukrantanam dhatunam, ojas structural component, bala is the functional component, ojas characteristics, some somatmakam, this is the descriptions which are given here. So essence of saptadhatu, vyadhi pratibandhakatvam, vyadhi bala virodhatvam is done by them. So now coming to factors again for autoimmune disease, this one aspect is the allergy, another is autoimmunity. So allergy is a hyperactivity, hypersensitivity of the immune system, and autoimmunity is also perverted immune system. These two are the some abnormal states of the immunity. So amavisha, dushivisha, gramya dosha, rakta pradoshaja vikaras, avaranas. So they are the areas where we can say that the autoimmune diseases are narrated. So importance of ahara is there. Aharam is described here in the context of ahara. Shattrichatam sahasrani ratrinam hitabhojanaha. Ahara is very important for the cause of any disease. So these are all the descriptions here which we have. So this is related to the ahara and possible modes of ama producing the disease. How the ama is going to trigger the disease condition, because one evidence is there, that is amavata described in Madhav Nidan. So he narrates the ama is one of the important triggering factor for the manifestation of autoimmune disease, which is very similar descriptions to the rheumatoid arthritis. And this is what actually the pathology is taking place. Madhavakara has described viruddhahara, viruddha chesta, mandagni, nischalata, that is sedentary life, exertion immediately after taking snigdha ahara is the causative factors for the disease. So this is what the Nidana described in Ayurvedic classics. Balam arogyam ayushyam pranasya agnau pratishtita. Agni is a very important factor, as Ayurveda believes in it and treats in it, because Kaya Chikitsa is only focused to restore the Agni. Agni has to be normalized by the treatment in the Kaya Chikitsa. Viruddham api aharam vidyat gara vishopamam. Viruddhahara is gara vishopamam. It works like a gara visha if the viruddhahara is taken. And here Srotoroda, Balam Brahmcha, these are the descriptions, ama, what they are going to cause in the body. So these are all known to you. Dushi Visha is, this is also what I discussed while saying about, but nowadays we are exposed to, we are swimming in the ocean of chemicals. Pesticides, chemical manures are widely used in India, and almost all the fruits, vegetables are infested with the pesticides and chemical manuring. Organic farming is now it's a ray of hope for the Indians. But now how this is going to cause, because they say that it is endocrine disruption theory has come in the modern system. These pesticides are going to disrupt the endocrine system axes, and then this cause endocrine disorders, especially in the majority of the population. So Dushitam Desha, this is what already I described while dealing with that. Then this I want to focus here. What does Gramya Ahara include? There is a description of Gramya Ahara described in Rasayana Chikitsa Prakarana of Charkasim. So what is Gramya Ahara? Gramya Ahara is Amla Lavana Katu Chara Pradhana Ahara. If you take, yesterday when I was in airport, there are several stalls. Healthy food stall is there, nobody is there, but pizza and other stalls, very rush is the big lengthy, because you see now the youngsters are now tempted towards this type of foods. And you can see Shushka Shaka, Shushka Mamsa, Kalka and Ruksha content, which have very low nutritional value, calorie conservation, incompatible, unsuitable contaminants, psychoneuroimmunological imbalances. That means emotional factors. These are all very important described in the Gramya Ahara. This is what the reference, you can refer the Charka Siddhi Chikitsa Sthana first chapter itself. Sarve Sarira Dosha Bhavanti Gramya Ahara Amla Lavana Katu. So what they are going to cause? Mamsani Sidili Bhavanti, degeneration of muscle mass is taking place. Vimuchante Sandayaha, looseness of joints are taking place. Very early ages, the people are now getting the low back and joint pains. And Vidahyate Raktam, Vishandyate Cha, Vishyandanam Vidagdham, both Rakta disorders are taking place. Analpam Meda, increased fat. So obesity is commonly seen. Na Sandhiyate Astishu Majja. So this is also degenerative changes are taking place. Shukram na pravartate, non-ejaculation of semen. Semen quantity is markedly reduced and several semen problems, infertility problems are seen. Ojo Chaya, depletion of ojas is taking place. This is not actually quoted by me. This is there in the Charaka Chikitsa Sthana, first chapter under the Gramya Ahara. So the remedy is also effects of Gramya Dosha, Glayati, Sidati, Nidra, sleepy, Tandra, drowsy, Alasya, lassitude, Nirutsaha, lack of enthusiasm, Swasthiti, dyspnea and simple exertion. These are all, if you see, very close to autoimmune disease. Manifestations of, if you see that book, they identify that the early identification of autoimmune diseases are, most of the symptoms which are described here are described in the autoimmune phenomena. So that means effects of Gramya Dosha, management of such diseases, what they have said, withdrawal from such ahara and vihara. The first Nidana Parivarjana has to be done, and next use of Rasayana. Again, because it is described in Rasayana Prakarana. So that is the reason why the Rasayana is one of the important. So now how the negative emotions are going to cause the immunological perversions is also there. Lesions in hippocampus, amygdaloid complex leads to enhanced immune response. All these are integrated components of limbic system. Limbic system is the seat of emotions. All the emotions are reflected in limbic system, and limbic system is going to directly act on the hippocampus, amygdaloid complex, leads to enhanced immune. So emotional feelings, if they are good, they facilitate the immune system, as it is there in the Achara Rasayana. Achara Rasayana is only to facilitate the normal immune system. And emotional feelings can inhibit the immune system, as it is seen. Several studies are also conducted. And emotional feelings can overreact. The reaction will be in the form of allergic conditions. So profound disturbance in mental state can cause great depression of body's immunity. Reduction in cell-mediated immunity is observed in 29 subjects whose spouses had died 6 weeks ago, because spouse death is considered as 100% stress in the stress parameters. So, severely depressed mental state suppresses the immunity. Anxiety or mental stress leads to deficiency of humoral mediated immunity. So, that is what the mental stress can influence cancer, streptococcal infections, rheumatoid arthritis, infectious mononucleosis. CNS is the between mind and the disease. Central nervous system is mediating through mind and disease. Demonstration of nerve endings in spleen and lymph nodes confirms the central nervous system influence on immunity. So, directly the limbic system or brain can influence the immune system, and immunological modifications, perversions and facilitations can be possible. So, Satmya Ahara, adapting suitable diet. How to prevent these autoimmune diseases? Forbid the Gramya Ahara. That is what it is described. And Vyayama, optimal exercise. Rasayana Chikitsa. Rasayana Chikitsa is a very important thing here. Adopting to wholesome substances, giving up unwholesome substances to which the physiology has been addicted since birth. Promotes immunity. Wholesome food to suit your constitution. This is while dealing with the wholesome. Shatrim Satam Sahasrani Ratrinam Hitabhojana. Hitabhojana, who takes suitable food, he is going to live for 100 years. That is daily exercise, is optimal exercise, and Rasayanam, regular use of Rasayana, rejuvenation therapy, and Rasayana Aushadas as mentioned in Charaka Samhita, Vayastapana Varga, Amruta, Abhaya, Dhatri. And among all the above, Amalaki is Sreshtam in view of its easy availability from Soma than Soma. Soma is a celestial herb which is not available. That is the reason why Amalaki is replaced for that. This is given that much importance. DST has started a project spending around 20 crores on the Vayastapana effect of Amalaki. I was monitoring committee member for that project. That project was given to 3 important base science institutes of India. That is one, Manipal University, JNTU, Jawaharlal Nehru Technological University, Hyderabad, and BHU, Gerontology Department. So, finally, they concluded that they worked upon 3 models: human model, Drosophila model, and animal model, that is rat model. So, in all these 3 models, it is identified that Drosophila supposed to live for 36 days. It enhanced its lifespan to 42 days. This is not a simple study. This is a very sophisticated study spending crores of money. So, finally, they concluded, even especially in the rat model, the repair, DNA repair is very fastly done. DNA repair is a factor for the senescence. So, the Amalaki is such a drug. Ahara Rasayana, good dietary habits; Vihara Rasayana, proper daily routine; Achar Rasayana, good conduct; and Aushadha Rasayana, that is Naimitika Rasayana, through drugs. So, nutritious diet, have milk and ghee in diet. Kshiragruta Abhyaso Rasayana Nam. This is also Ajasrika Rasayana. Timely eating is very important, because we have a biorhythms and biological clock inside. Timely sleep and timely eating habits are very good. Not less, not excess. Avoid preservatives, refined foods, fried foods. These are all. But in the name of Ayurveda, we heard in the previous lecture that number of chemicals are added, number of preservatives are added. They are not actual Ayurveda, but in the labeling of Ayurveda that we. So, Vihara Rasayana, Achar Rasayana is also mentioned, and some Rasayana drugs, single herbs are also described in Ayurveda. So, in the rheumatoid arthritis, if you see, Amavata is a very close descriptions are same, but we conducted the Vaitarnavasti, Madhutailikavasti, Rukshavasti. Rukshavasti is a unique procedure actually. In the initial stages we can give where no thaila is given in the Vasti, only Kashayam is given with the Shaddharna Churna as a Kalka, and you have to monitor. You can give hardly 3 to 6 days. Once the Ruksha is manifested, then you have to stop. So, initial stage Rukshavasti is a very ideal one. And Amrita Ballatiki Lehyam is a very favorite medicine for me. and we proposed a project for CCRAs on cell lines. We used to use in all the autoimmune diseases, all autoimmune diseases. You remember, any autoimmune disease, if you come across, including the idiopathic thrombocytopenias and nephrotic syndromes, even Hashimoto's thyroiditis, Graves' disease, and all these conditions, Amrut Ballatiki. So it contains actually 3/4 of the quantity is semicarpus anacardium. So many people are afraid of prescribing it, but if it is properly processed, it is the best rasayana which is available. So it contains so many ingredients. We have this much number of ingredients are there. So this can be given in Amavata. We used to give in myasthenia gravis, ankylosing spondylosis, systemic lupus, nephrotic, autoimmune, hemolytic anemias, idiopathic thrombocytopenia. So you remember Amruta Ballataki whenever you come across the autoimmune disease conditions. Ingredients, this is actually, this was the work done by the Abhishek in my systemic lupus erythematosus is another one. So systemic lupus erythematosus is an autoimmune disease condition, whereas cutaneous lupus, lupus nephrosis, lupus arthritis, 3 manifestations are seen. We come across all the disease conditions, but the disease process, Vata and Rakta vitiated condition, involvement of skin, joints and vasculature is seen. Utthana and Gambhira resembles cutaneous and deep tissues. It is very similar to Vata Rakta manifestations, Utthana Gambhira. Lupus nephrosis does not fit into Vata Rakta. That is of course a different thing. It comes under the Prameha. Utthana is managed by Abhyanga, Lepa, Kayaseka, Upanaha. Gambhira is managed by Virechana, Astapana, Sneha Panair, Gambhira Macharet. So the typical things are there. Cutaneous lupus, we go for this. Lupus nephrosis, these are the drugs because of the constraint of time. So I am just fastly forwarding it. Figinchal, Potali is the very good thing. So the Raktamoshana, simple Raktamoshana can be done at your level, at the OP level also, where you need to have a butterfly needle, and butterfly needle tie above and then take out the blood. So you need not go for any other things also. Dhanyamla Dara is one of the very famous, and by seeing the face you can identify the systemic sclerosis, scleroderma. The face itself you can, and when such patients come to you, immediately you can identify. So scleroderma associated antibodies, in the condition of scleroderma, Bala Gudu Chadi Kashayam, Gugulu Tikta Kashayam, Kaishor Gugulu, Amruta Rishta, Amruta Ballatiki Lejam, Pindatailam, Bala Gudu Chadi Tailam. So they are very commonly prescribed areas. Multiple sclerosis is another important area. This we come across MS commonly nowadays. T-cell mediated autoimmune disease of the central nervous system characterized by demyelination of the brain and spinal cord taking place, inflammation and dissemination of lesions in space and time. So symptoms, visual defects, weakness, sensory deficits, diplopia, ataxia, cognitive deficits, bowel bladder incontinence, all these things are commonly we come across. So this is the pathology. So lesions, you can see the MS lesions in the B. The pre-contrast black holes are also seen here. The post-contrast disease activity is seen here. So usually whenever you come across the conditions of MS with the deglutition problems, you remember the Brudva Chintamani. Brudva Chintamani is such a wonderful drug which was prescribed by Pandit Shiv Sharma to Jawaharlal Nehru in 1961 for his problem. Pandit Shiv Sharma prescribed the Brudva Chintamani to Pandit Jawaharlal Nehru, and immediately the team of experts from All India Institute of Medical Sciences objected that it contains heavy metals. So then with the help of Jawaharlal Nehru, they proposed a project, and project concluded after 10 years that the Brudva Chintamani, though it containing the heavy metals, not containing any deleterious effects on any part of the body, by that time the Jawaharlal Nehru was not there to receive it. So such a drug, Panchagavya Grutam, Jyotishmati Tailam, Amrut Ballatiki, Anu Tailam. So this is related to juvenile diabetes. But whenever you come across juvenile diabetes, you can minimize the dose of insulin. and you can improve the quality of life, you can minimize the complications of diabetes. This can be, we can, as a add-on therapy, we can go for. We cannot completely say that it can be replaced with the Ayurvedic medicine, but as an add-on therapy, we can use, not as a standalone therapy. So in this, I used to give Vasant Kusmakaras once a day for 10 days, repeat such therapy once in 3 months, for 10 days. So regularly I give it, but it has to be processed with 1 or 2 drops of ghee